my name is Tajira Lockin, and today I'll be inserting the Foley catheter into a female patient. So before doing so, I made sure that all my equipments were set up and I was ready to go. So I'm going to first go into the patient's room. Hello, my name is Tajira and I'll be your nurse today. Can I please have your name and date of birth?
Stacy Henderson, 12/12/96.
Okay, Stacy, so I'm just going to go ahead and check your bracelet just as a confirmation. So today, an order was placed to insert a Foley catheter. Have you ever had a Foley catheter inserted?
No.
Well, this is just a tube that is placed into the bladder just to help to get the urine out. So, are you allergic to iodine as well?
No.
Okay. This is just to ask, just because we use iodine while inserting the Foley catheter, just to clean it up. I'm going to go ahead and provide privacy as well. And I'm just going to go ahead and set you up a little. I'm raising the bed just a little bit more. And then I'm going to put your leg into a frog-like position just to make everything a little bit easier. Try my best not to expose you too much. Then I could go ahead. I'll go ahead and just to wash my hands. Then I could go ahead and open my kit. I'm going to make sure to open away from me first. Once it's open, I'll go ahead and take my drape. And I want to place the drape under. So I'm going to go ahead and place the shiny side down. This is just in case any urine was to come out, it will drop on the drape, and it's just to expand my sterile field as well. Then I'll go ahead and take my gloves out. Just kind of turn it around a little. I'll go ahead and place it on my dominant hand first. Okay. Then I'll make like an L shape, and then I'll go ahead and put this on. Touching on the inside, that's okay because now that's sterile on sterile. I'll also go ahead and throw this out. Try not to drop my hand below my waist. That will go in the trash. Then now I can go ahead and rearrange my sterile field just to make sure that everything is in the right order. I'm also going to go ahead and pour my iodine over my cotton swabs. I'll also go ahead and make sure that my lube is poured out. And I'm also going to go ahead and connect my bulb syringe right now. In concern to connecting a bulb syringe, while connecting it, you could go ahead and inflate just to check to make sure the bulb inflate. But this is all dependent on your hospital policy. I'm not going to do this right now. Then just to make sure that everything is ready, I'm also going to go ahead and lube my catheter. Make sure to throw that out as well. Once it's lube, I'm just going to make sure that it's right there and everything is situated. Now I'm going to go ahead and clean the patient. So I'm going to make sure to use my non-dominant hand because once this is on, I cannot go ahead and remove it and touch anything because that could really contaminate the area. So I'm going to go ahead and spread the labia. I'm going to go ahead and wipe away the one furthest away. Throw that in the trash. Then I'll go to the one closest towards me. Then I'll use the last one to go right down the meatus. Once that's done, I'll go ahead and get my catheter. Try my best not to let it touch anything because we don't want to contaminate it. Then I'll go ahead and just drop that, making sure my catheter is not touching anything as well. I'm going to ask the patient just to breathe in. I'm going to go ahead and insert 2 inches 2 to 3 inches. And then if I see backflow of urine, I'll go ahead and insert just a little bit more. Then I'll go ahead and inflate my balloon. Once that's inflated, I can go ahead and take that off. And I'll go ahead, connect, make sure that it's secured, and I'm leaving the port open. I'll go ahead and clean up. I'll also connect this part to an immovable part of the bed. I'll make sure it's initial, date, and time this as well. And just to know the color of the urine, how much urine was in the catheter as well. And I'm just going to document how the patient took the procedure as well. I'll go ahead and place this on an immovable part of the bed. Then this is already connected, and I'll just go ahead and set the patient back. I'll go ahead and cover them. And then I'll just ask the patient, make sure the call light is in reach and the bed is in the lower position. And ask the patient if there's anything I could do. If not, then I'll go ahead and clean up, and that's it.